Welcome back to Lav-Living Wellness Channel. You are with Dietitian Vicky. We are still looking at the heart. We talked about women, we talked about men. Today we are talking about high blood pressure. And that is just something that is it may not be a conversation that is needed for someone, because let's face it, so many people are living with high blood pressure. You know someone that has high blood pressure. Your grandmother, your aunt, you always know someone that is on blood pressure medication. So today I would love us to look at other ways in terms of wellness, in terms of lifestyle, in terms of nutrition, that you can add into the basket of care and improve how your body maintains its blood pressure. Grab that coffee, hit that subscribe button. They taught me this language, well, I don't know what else to say. Subscribe, share, like. But more than that, importantly, what is important for me is that you are here and you are sharing conversations with me, that you took your time and to share this conversation with me. I appreciate that. Let's just have it. All right, so we're going to talk about this high blood pressure that everybody seems to have it. I'll tell you one thing. When I was in medical school, the only people I met, and I was in medical school 20 years ago, I studied at Medunsa. When I was in medical school and you're talking about things like high blood pressure, you mostly met the elderly. We talked about complications of high blood pressure, like cardiovascular complications of high blood pressure. Still, these were things that happened to the elderly, and there were also things that happened at the main to white people. No pun intended, it's just that the way, I don't know, it's almost as if disease is picked as by races. But over years of working in the medical space, doing a lot of nutrition counseling, diet planning, seeing patients that has many conditions, renal failure. I remember that years ago when I was even doing my intern at Josh Mukari, it was then Garangua Hospital, the renal unit, the dialysis unit that was there, it was not having many patients. And even when you went to work at dialysis unit, you went there like, you know what, I'm working at the dialysis unit, because then you'll have people that are coming to dialyze from Limpopo, many other hospitals brought their patients to Harangua Hospital for the dialysis. So, but now, if you go to many towns, there are many dialysis units. And why am I mentioning dialysis and renal failure? Because renal failure is one of the complications of high blood pressure, untreated, uncontrolled hypertension. So in as much as hypertension is very common, and a lot at times, many people don't take having high blood pressure as living with a chronic condition. People will take diabetes serious. People will take having HIV serious. But high blood pressure, nobody thinks there's a deal to it, you know. Even if people are diagnosed with high blood pressure and medications are prescribed, dietary lifestyle recommendations or changes are recommended, people will be thinking, can I stress? And then the doctor said, can I high blood? And that's that. And often people don't actually recognize that hypertension itself, it produces even more cardiovascular complications than anything else. And I think mainly because it's often left untreated, often left unmanaged, and a lot of people don't necessarily pay attention to managing their blood pressure, right? So in these conversations, I have an important man in my life. He's my son. He can just say hi and nobody will see you, just say hi. So as we are talking high blood pressure, and we covered issues about males, he's a very young man. This one just sounds older, but I would love for him to understand how important his health is at this age as well. All right. Okay.
That's what it means. Next time it's.
I also didn't know. I'm hearing it for the first time from my 2010. I hope waka waka is not a bad word.
The song.
Oh,
Shakira.
the song. Oh, I don't really like. Okay. Nonetheless, so high blood pressure, it's something almost every, like in a household. I don't know a household that does not have someone with high blood pressure. If you don't have high blood pressure, somebody in your home has high blood pressure. It's usually like that. You find that, especially in a household that has got many generations, there is someone with high blood pressure, there is someone on blood pressure medication. So let's talk about what high blood pressure is. And as a young person, as an old person, how do you notice that you have high blood pressure? And when you do, because here we're talking the lifestyle, nutrition, therapies that you can actually follow to improve your blood pressure. So let's start with the numbers. We all have blood pressures, right? And blood pressure is something that is beautiful, but the issue is when it is high or when it is too low. So this is what happens. Your heart pumps blood, ne? Son, you hear? Your heart pumps blood, and blood will distribute everywhere in your body. So now with that circulation flow, we have the pressure that your heart must have to pump blood and send the blood out. And there is also a pressure that the blood must return back to the heart wall. So you can imagine that you have blood that went all the way to your small toes, and that blood must return. You can imagine you've got blood that went to your fingers, that blood must return. So there is a pressure that your blood must return with. There is a pressure also that your heart must send blood into the veins. And when you imagine these pressure balances, it's such that imagine flow without control, like it's going to flood, like wow. But you don't have blood that flows like that. There is control in terms of how that blood must flow. That is pressure. And there is control in terms of how that blood must flow back to your heart, such that even when it enters back into the heart, it's not flooding the heart, it's not going wow. This is pressure, and it's called pressure controls, right? So even when blood moves from your heart to your lungs for gas exchange, it's also not flooding the lungs. There are controls there. So when we're looking at blood pressure, that's what we mean. But if we talk about pathologies of this pressure control, then we talk about high blood pressure. So when you say someone has got high blood pressure, what it means is that there is a lot of resistance that your vasculature is generating against your heart when the blood returns. Does that now make sense? Mm. So, or there is also a lot of pressure that the vasculature is generating against your heart, such that your heart struggles to send blood out. So, like that. So, in short, in simple ways, it actually means there is a pressure resistance that your heart experiences when it must send blood out. That is called high blood pressure. Particularly when we say high blood, the person with high blood pressure, it means there's a high resistance you experience, that your heart experiences when it sends blood out. But of course, along the journey of being diseased, you will have a lot of pressure control issues. Sometimes you find that maybe when the blood returns, things are not going well, things like that. So yeah, that's that. When you say people have got high blood pressure, it means there's a big resistance that is generated against your heart when your heart needs to send blood out. So when your heart wants to send blood out and there's a lot of pressure, it means your heart must do what? Pump even harder. And the more resistance your heart experiences, the more your heart must pump harder. In the course of time, what you experience, and which is one of the most common complications of having uncontrolled high blood pressure or having high blood pressure for a long time, the heart tends to swell or enlarge. I think the word swelling in English, but what it means that the heart tends to become bigger. Right, so you will find that now doctors will say the person has got an enlarged heart, right? So you find that even if when you look at the chest x-rays, that heart can actually look quite big because it has been doing a lot of manual labor trying to pump blood out. I hope that part now many people understand. So if you find that now they say this person has got high blood pressure, the heart has become big. So unfortunately, when that heart becomes like a big guy, it looks big, like it's supposed to be strong, but it's not strong. That extra muscle that it was gaining, it's going to actually affect the heart in the course of time, because remember the heart works with electricity. So that big giant of pampa muscle is not responding to the electricity in the heart. So it becomes heavy, and it also deters the small muscles that are there that are supposed to be functioning. So you've got a big giant of a muscle, like a gorilla muscle, but that gorilla muscle is useless. It makes the heart weak. It is not picking up the electricity of the heart, and it will also get the heart strength to pumping blood outside even much more compromised. It also will compromise the flow of electricity in your heart, compromising the rhythm of your heart and things like that, even compromising the valves, those pressure controls that are there to make sure that there's no flooding, or that when blood is supposed to get out, it doesn't remain back, and things like that. So having that enlarged heart on its own also presents a lot of complications that come with high blood pressure. I hope that makes sense. Again, we talked about lifestyle issues that will also bring complications to how your blood pressure is managed. And being a dietitian, many times I find that when you say to people, do look at the things that you eat, especially those that can affect your vasculatures, like we said, things that can clot. On our previous video, check out our previous videos. We were talking about how you can block your arteries. Remember that when you block those arteries, or you harden them, or they are hardened, they're stiff, or they are blocked, you will struggle to send blood outside or returning back in. So that's when doctors will talk about a patient developing failures, maybe on the left ventricular failure and things like that. Or they will, when you have your doctor, they will actually explain which part is a problem for you. But I'm just trying to simplify it for you so you understand, without just trying to simplify it so that you understand what do they mean by that. But looking at what your diet contributes to all those complications of high blood pressure. If you eat food items, previously I spoke a little bit about sodium, and I didn't want to go so deep about it. Things like a packet of Simba chips as an example. Simba chips have got a very high sodium. You can just flip the food labeling at the back. You look at the sodium amount there, and you will see how much sodium is per 100 gram of that packet of Simba chips that you have. So because of that sodium, when you eat something like Simba chips, for instance, sodium, when it comes to the vasculature, remember I said it's the pipes. When it comes to the vasculature, it kind of traps water in, and it makes your veins to swell. So that's when sometimes you will experience people with high blood pressure that tends to experience something called pulmonary edema. So even when they say you have congestive heart, or a congestive heart failure, or you're developing a congestive heart failure, what it means is that the vasculature there, swollen, it carries a lot of fluid. It's like if your nose is full, you know how it gets there's a lot of mucus. But about the heart, when you have condition like high blood pressure, and then they say to you, hey Mugai, you are having congestion, what that means is that you are feeling a lot of water in that space, in the lungs and the heart area. How does your diet contribute that? So if you eat food items with a lot of sodium traps a lot of fluid. So I hope now it's simple. So mhlambe, you went, you bought a quarter, you are eating a quarter, So because in the quarter, Paco, what's in the quarter?
Last number.
What?
Burger.
Mm-hmm.
Chips. Arch. French. Russian. Vienna.
And then what?
Bread, cheese, poroto,
Yeah.
cheese, sauce. Yeah. Yeah, sauce.
Oh, okay. So remember, let's talk about the sodium amount in all those things. Ne? That's the last number got again. A healthy person, your sodium amount per day should not really go more than 4,000 milligrams per day. Now, that's in a regular healthy diet, right? So let's take about that quarter. How much sodium do you think that quarter has?
26,000.
26,000 milligrams. That is 26,000 divided by 4,000 milligrams of sodium.
6.5.
So relatively, let's assume that's more or less that. It's not exactly, even if it's not the exact amount, but more or less there. It's not far. So you are already eating at least 6 times more than what you are supposed to be eating of that sodium.
Just yes.
And that's not the whole thing. That's not all you are going to eat in a day. For us, the research says South Africans generally consume 10 times more sodium than what we are recommended to eat. So now you understand why your great-grandmom did not have high blood pressure, but you had. Think about if Paco's last number is something that somebody lives on, right? Do you now understand why a 25-year-old will have their blood pressure high? It never used to happen. And where would that come from? The type of food that the person eats. What would that food do? It will create a lot of cholesterol, a lot of triglycerides that will cause inflammation in the veins and also create that plaque material that I was talking about that blocks the drains. But also that amount of sodium is going to bring in a flood of water, flooding the lung and the heart area. Even if it doesn't flood the lung itself or the heart itself, but the vasculature in that area will trap a lot of water and swell. Right? One of the complications is the congestion. So I was giving you an example from the diet that when you eat a diet that gives you high amounts of sodium, you will create congestion around your lung and the heart area. I used to never see young people, with high blood pressure, but I can tell you today, as I speak, you can ask any nurse that work in any clinic, even in the state clinics. There are many 30-year-olds that are on hypertensive medication. So I wonder if you are 30 years old and already on antihypertensives, by the time you turn 50 years of age, I don't know what would have happened to your vasculature. So you see, you are young. Outside, your ID book is young, but metabolically, you are already 50 years of age. Inside, not outside. So that's when we're talking about taking care of yourself. So looking at that sodium, we're talking about the patties, the burgers. You'll find things like processed food, even spices, that has got a lot of sodium in them. And for this one, I get when you go komasung, how we are come Friday, we cook and we do all kinds of things. The spices that I tend to find in a lot of people's cupboard that I want to, my God, because of the sodium in it. Those cubes? I don't want to mention them by their names.
We're not promoting any brands, but
okay. The cubes. Like you can never lack those cubes, and I do find these cubes in a lot of people's households. But the sodium content of those cubes are extremely high, right? And they're not suited for someone with high blood pressure, someone with congestion, and things like that. So it's things that should not come to the groceries. When you have a household with someone with high blood pressure. There is also something that people like. Those powders that you use to make gravy? The gravy powder. There's sodium content in that thing. is just extremely very high. So if you can actually learn to make your chakalaka without that gravy powder, you can make the gravy without the gravy powder. You can make the stew without a brown onion.
It's not nice.
It is nice. I'm going to cook it for you.
It's not nice.
I will surely cook it for you.
So when you go
there are many ways of cooking without. Look, there are things that we add in the food. There are things that you add. But this is not about sabab. It's not about ekasi. It's about looking after your heart health. To say, what is it that your great grandmother cooked with? Because your great grandmother did not add any of these things, and they still cooked good food.
meat.
We are not living back in that date. We are living today, and you are here. So, question is, even if you're going to use those things, right? It's about how are you going to use them. If you use them occasionally, that's okay. But then again, people don't use them occasionally. They are like, you cook a chicken, you put the cubes. You cook the chicken stew, you put the cube, and then you put the gravy powder. You cook a gravy, you put the gravy powder, you put the cubes. The consumption gets very, 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 very high. So I don't know if you hear my message very well. But these things contains very high sodiums, but you can moderate the use to a minimal usage. Because like you said, you still want to have your gravy with the gravy powder. Yeah. Hard. And now something that I just want to wrap the complications of high blood pressure with, I'll just wrap it with 2, but the other one will focus on the other time. I want to talk about kidney failure, which is one of the most common complications of high blood pressure. We're not going to talk about it today. Keep checking our channels. We will actually unpack it. It's a very big conversation to have. Today, what I want us to close with, looking at the complications of high blood pressure, it's the way blood pressure affects circulation in the digestive system. And why am I saying this? There was a case of a patient that I had in ICU, I think about a year ago. The story of this young man was very painful for me because as I looked at him, this guy was 32, he was obese, he was quite large. He had very high cholesterol. His sugar levels were not so well. He didn't know that he was diabetes, and in fact, he was not diagnosed with diabetes. It's just that at the time when he came to the hospital, he had impaired sugar levels. His blood pressure was high. He also did not know that he was hypertensive, and even if he knew what he said, he was not so certain about it. That occasionally he'd gone to the clinic at work and he discovered that the blood pressure was high, and we'll close it with the story. He discovered that his blood pressure was high, but he thought it was just something that happened at that point. So he didn't quite understand that he has a chronic condition. And for him, that was just that. So when I met him, it was over the weekend. He came, he was admitted in ICU with an acute abdomen. What does that mean? It means his intestines were kind of on leave. They were not functioning, they were not moving. So the digestive system was not digesting. He was not having fecal movements. He was not passing stools. It was like he was constipated. It was like he would eat and then he would feel like there's indigestion. So meanwhile, the abdomen was just distending. There was gas and he was having epigastric pain. So what brought him to the hospital was that he was having like sharp abdominal pains. And I'm doing this because this is where he's true, he had these kind of pains. It was that intense. This abdominal pains and things were that hectic. So when I was called to see him, it was because they were trying to find a way, what can he eat? I mean, he's alive, he wants to eat and things like that. So they called a dietitian. I get there, I sit down with him and he tells me that it's been a week that he's struggling. He vomits a lot. He has pains and by now he feels very sickly. He's struggling to eat. Nothing seems to go in, nothing seems to stay. And he's hungry, he's tired, he's in pain. So as we're talking about that, and he's already done his abdominal sonas and abdominal x-rays and things like that, this is the part that was so painful for me to bear, even when I think about that young patient. There's a big vein that comes across somewhere there. It's called the mesentery. This guy had been having high blood pressure for a long time. He did not know. There's something that happened to that vein. It was like there was no blood that was flowing in that area. So he experienced something we call ischemia. And then I will explain again what ischemia is at the next video, because this is something that is also very common. But in short, for you to understand this guy's story, ischemia just means that that area is not having circulation and it has experienced death because of that. So you can imagine this guy did not know that he had ischemia at some point in his mesentery, so which meant the entire gut could not work. While this guy was alive and he wanted to eat, when I looked at him, I couldn't even explain to him that, my guy, your system is as good as not there. There is no way we are going to eat pap, we are not going to eat porridge. There's no way we're going to eat any of that. And in fact, at this point, we are just going to put up a tube that we cannot put in your stomach, but it's going to feed into your vein. And for some time, up until doctors can figure out how to salvage the situation, if it can be salvaged, right? It was so painful to look at that guy a week in, 2 weeks in, 3 weeks in, 4 weeks. It was somewhere when it went like about week 5 that he started to understand what exactly is happening in his intestines, that nothing can work and nothing is working there. And to actually put 2 and 2 together, that it was the high blood pressure that caused death in that abdomen. And I'm just trying to simplify it because it was much more intense than that. I'm just trying to simplify it. It was so painful to lose a young life because of high blood pressure, and something that it was preventable. This was a very preventable death. If this man knew, he would have focused on losing his weight. He would have focused on maybe trying to have a very low sodium diet. He would have focused on his exercise. He would have checked his blood pressure to know his numbers. So these are the numbers for you to look at. Your blood pressure comes in 2 numbers. The top number must not be above 140. The bottom number must not be above 90. Ideally, you should keep the top number around about 110, 120, and keep the bottom number around about 80. So, our conversation is closed there. I thank you so much for spending time with me. You can send your conversations, you can send your questions, your comments. It was so wonderful to spend time with you. Again, as we leave, click that subscribe button, that like button, and okay, hit that like, share our videos, and we look forward to spending time with you again as we talk about this lifestyle and things like that. All right, thank you, bye.